Thank you, Madam Speaker. I rise to ask question 76 of 2015, stating in my name on the order paper today. The question is directed to the Minister for Health and Medical Services. Would the Minister inform the Parliament of the outcome of investigations into the death of the newborn baby of Pritika and Jasveer Lal at the Lautoka Hospital on Sunday, 30th November 2014, in accordance with his statement in Parliament on 12th of December 2014?
Thank you. The Minister for Health and Medical Services.
Thank you, Madam Speaker. I rise to answer the question. 76. I think at the outset, the loss of any child is something that none of us wants to see. And it's unfortunate that this has happened. And within the ministry, it is something that we are looking at very seriously to try to address. The investigation has been undertaken. It's been undertaken by people who are professionals in this area. And the investigation has found that the baby in question passed away because of, the technical term is prolonged hypoxia due to the severe shoulder dystocia. That has been the technical cause of the problem that happened for this particular baby. In the findings of the team that carried out the investigation, the team was not critical of the technical skills of those that were involved, but they have identified a few areas that we in the Health Ministry will have to improve upon in order to make sure that these kinds of problems are minimized in the future. The number of issues that the investigation team found. It found, for instance, that part of the antenatal history of the mother in question was missed, and that in case a diabetes screening test was not done. So this is an area that we are now looking into improving within the ministry. The team has found that the staff in the antenatal clinic at the Mission Hospital should be alerted to these criticisms, and they have been. They have been alerted as to the areas that need to be improved. The team has also found that there are a number of issues requiring urgent attention at Lautoka Hospital maternity unit. And these issues can compromise the level of clinical care. And this is something that is now being addressed through our clinical services network that looks into the area of obstetrics and gynecology. The other area that has been identified by the team that carried out the investigation is that the staffing in all shifts in the birthing suite should reflect the caseload and complexity for the shift. This is also that we're looking at. And that there should be formal handover rounds for those that are coming into work at different times, that patients should be consulted about management plans, and also that the medical officers should provide better support to the midwives. So what I can say, Madam Chair, the investigation has been carried out. There are a number of processes, there are a number of areas of training that need to be enhanced, and those will be addressed by those that are looking after our hospitals, especially where maternity issues take place, mainly in Lautoka, in Lambasa, and here in Suva. Thank you, Madam Speaker.
Question, Madam.
Honourable Prem Singh, supplementary question.
Madam, now that the investigation has taken place, what is the remedy available to the victim and the victim and their families? I believe there has been some correspondence between the Solicitor General's office and the victim solicitors. Where do we go from here?
Thank you. Honourable Minister for Health and Medical Services.
Thank you, Madam Chair. I think that there are avenues available legally for people to pursue any action that they wish to undertake, but that is all I can say about that. From my point of view as Minister of Health, my emphasis is on trying to improve the processes to make sure that we can minimize this in the future. Thank you, Madam Speaker.
A supplementary question.
Supplementary question.
Now that the investigations are complete, I understand, is the ministry admitting liability?
Point of order.
The question being put is to the Minister for Health. He's not the Attorney General. The question that I'm emanating from the Honourable Member is to do with legal liability or culpability for that matter, and I think it's misdirected. Thank you.
Thank you. The question is not accepted. Supplementary question, the Honourable Vande.
Supplementary question, Madam Speaker. How will the Minister confirm that this problem will not be repeated in future.
The Honourable Minister for Health and Medical Services.
Madam Speaker, I think there are some things that we cannot always predict. You cannot always predict whether you're going to live or to die all the time. The best that we can do is to learn from the experience that we have, identify what we can do to improve the processes so we can reduce the risk. Nobody will be able to. Dystocia is something that happens very rarely, but when it does happen, it can have an impact. What we are intending to do within the ministry, we're increasing the drills so that our teams are aware of the likely complications and how to address this. But you can never, ever eradicate the fact that somebody could pass away. We'll do it to the best of our ability, but you can't give a guarantee that that will never happen again.
Thank you. And our last supplementary question.
While we have the minister on the floor, and while the subject is on Lautoka Hospital also, one of our members lost his wife because the lift in Lautoka did not work. Has the lift in Lautoka Hospital being fixed, Madam Speaker?
Thank you. The supplementary question does not relate to point of order.
Point of order, Madam Speaker. That's completely a new question.
Thank you.
Talked about Lautoka Hospital, Madam Speaker.
Thank you. Thank you. As I have mentioned, the supplementary question does not relate to the baby Pritika case.